This is a brief introduction to real-time satisfaction surveys using the Minute Survey tool developed by Alemi and colleagues. The Minute Survey offers several advantages over the CAFS survey, which is currently advocated by CMS and others. First, the Minute Survey is simpler because it asks the user to answer only 2 questions, while the CAFS survey asks 26. This is a 93% reduction in length of the survey, which means that users are more likely to complete it and only have to focus their attention on 2 questions. Second, the shorter length of the survey allows us to conduct the survey on exit on all patients. This means that the data on patient satisfaction will be available in real time. Current patient satisfaction reports are available quarterly, way after the quality issue has already been resolved. In contrast, real-time surveys are available as events unfold and therefore can attract management attention to causes of dissatisfaction before it's too late. Third, our real-time surveys provide a control chart indicating time to next dissatisfied patient. These control charts ignore occasional dissatisfied patients and focus on patterns of repeated dissatisfaction within a short time interval. These charts distinguish between systemic problems versus occasional mishaps. And finally, these charts are especially useful for improvement teams that want to examine if the changes that they have introduced have led to increased satisfaction. And finally, our method of collecting and analyzing satisfaction information costs radically less than current approaches. Our calculations show that our method is 89% less costly than current approaches to collection of satisfaction data. Thus, not only will you have better and more timely data, but the process will cost less. Our satisfaction survey is based on 2 questions. The first question asks if you were satisfied with your care, and the second question allows you to enter free text about what worked well and what needs improvement. These 2 simple questions is all you need to ask. We refer to this survey as the Minute Survey because it can usually be completed in under 1 minute. Because the Minute Survey is short, it can be collected on exit. The response rate to Minute Survey collected on exit and without reminders was 77%. This is more than double the response rate of longer surveys collected after exit and with costly reminders. One reason the Minute Survey costs less to do is because of the response rate. The higher the response rate, the lower the need for sending costly reminders to patients, and the lower the cost to administer the survey. You may be concerned that a 2-item survey will not cover all of the necessary topics that a longer questionnaire does. Well, this is not the case. The first item in our Minute Survey is a rating of global satisfaction. Numerous studies have shown that the response to this question is correlated with response to other questions. For example, global satisfaction rating is correlated with global rating of quality and with whether the client recommends the provider to others. Even though these questions are not asked, they can be inferred from the first question in the Minute Survey. The second question in the Minute Survey is an open-ended comment. This is preferred to longer surveys that insist for the patient to comment on a specific aspect of care, such as food or nursing care. An open-ended question is preferred because it allows the patient to choose what they would like to address, and this prevents the survey from posing leading questions that bias the results. The comments that patients make are very useful to improvement teams. These teams can understand the reason for dissatisfaction from the comments. Here, we see an example of a comment that praises nursing. Here, for example, we see another comment that helps clarify the source of dissatisfaction. Note that this comment would not fit into the standard longer questionnaires, as no questions are asked about anesthesiologists. Here is another comment. Again, open-ended comments are more informative about what is the cause of dissatisfaction. First, the comment is parsed. Natural language text processing is applied to the comments. The phrases in the comment are parsed to apply to questions in the longer CAFS survey. The net result is that even though we ask only 2 questions, much of the information in CAFS surveys can be inferred from this short 2-item survey. The minute survey can be collected in different ways. We have the capability to collect the data through postcards, collected through drop-off boxes or through mailboxes. We also have the capability of collecting the data through an IVR telephone system where patients are asked to call into a phone number and record their comments. Finally, we can also collect the data through the web, available through inexpensive computers. Our preferred method is to use the computer as it allows immediate analysis of the data collected. The reports from the minute survey are available immediately. Here, you can see a control chart showing occasional dissatisfaction in the 14th and 21st visits. These are ignored. When the rate of dissatisfaction exceeds the control limit, then the manager of the unit receives email alerts that there is something occurring in the process that is unusual and may need his or her attention. If you decide to use our services, it takes about 3 months to set up the data collection computers at your location. A pilot test of the system can be completed within 6 months. Participation in the pilot is free of charge. After the pilot, you can decide if the proposed system can replace your current contract for satisfaction surveys. Now, we will answer some frequently asked questions about the minute survey. How soon after a survey is completed is the data analyzed and reports made available? Immediately. Data are added to reports as they become available. Organizations ask if they can use their existing data with the minute survey. Yes, but keep in mind the quality of your existing data. They are collected on a sample of patients and are reported with significant delay. Organizations ask us, what is included with the minute survey? Do we get software? Do we get reports? You will have access to an internet portal that enables designated personnel to download your own reports on demand. Is the data confidential? Yes, the data is confidential. No patient identifiers are collected. Average satisfaction reports are available to designated personnel only. Benchmarked data is provided by averaging across at least 2 peer organizations. Organizations frequently ask us, who compiles the data? Is it the hospital or staff from your organization? Neither one. The data is compiled by the computer and reports are prepared without any personnel involved. This is why we can provide the analysis on demand. How much of a cost savings can one expect in a community hospital? On a typical satisfaction survey contract of $200,000 per year, one could expect a savings of 3/4, or enough to hire 2 new nurses. How do I know that the minute survey will help us improve? Try a pilot. Test it for yourself. The participation in the pilot is free. Keep in mind that the minute survey provides better, more timely information at a lower cost.